Hello, and thank you for having me today, Ann and Sarah. Appreciate it. My name is Scott Bolasky, and I'm the Senior Sales Manager for SureFit. I know that everyone's time is valuable, so over the next 25 minutes, we'll quickly cover who we are, our Medicare document management service, shoe selection tips, and fitting support. And then we'll leave 5 minutes for Q&A at the end as well. All right, so let's start with a little background about SureFit's vision. So partnership is what we believe in, and we understand that your priority is patient care. So it's our mission to continually expand our business to give you back time to spend with your patients. We will continue to provide exceptional service and explore new ways to save you money on material costs, but we've made it an objective to deliver more than just products. We know that shoes can be difficult. Staffing challenges through COVID made it even harder. However, we've built podiatry-focused solutions that simplify providing diabetic shoes. For those that are not aware, SureFit is part of the Hanger family of companies. Hanger owns and operates 895 O&P clinics throughout the U.S. SureFit services these facilities along with over 1,000 podiatry offices to streamline the diabetic shoe process. So here's some background on the Medicare diabetic shoe program. CMS has very specific documentation that's necessary prior to dispensing diabetic footwear. The Therapeutic shoe bill was passed in 1993 as an act of Congress. The bill was designed to help prevent lower limb ulcers, amputations, and other complications for patients with diabetes. According to Podiatry Management's 2023 annual survey, only about 48% of podiatrists dispense therapeutic shoes. Medicare documentation requirements and audits have significantly reduced the number of providers dispensing therapeutic footwear. So comprehensive foot care programs can reduce diabetic foot amputations between 45 and 85%, according to the CDC. Less than 20% of those who qualify for diabetic shoes are actually receiving them. And the leading cause of non-traumatic lower limb amputations in the United States is diabetes. So a study compared over 26,000 patients who received shoes and inserts, and the results showed that a 12% reduction in ulcers and an 18% reduction in amputations. Here's the PDAC description for a diabetic shoe. An A5500 is for diabetics only, fitting including follow-up, custom preparation, and a supply of off-the-shelf depth inlay shoes, manufactured to accommodate multi-density inserts per shoe. The four main criteria for a diabetic shoe is that it provides a minimum of 3/16 inch of additional depth, that it's made of leather or other suitable material, that it has a closure system, and that it's available in full and half sizes with a minimum of 3 widths. All of the shoes in the SureFit catalog are PDAC approved. Okay, so what is a diabetic insert? There's 3 types of inserts. The A5512s are a prefabricated multi-density insert. These need to be heat molded to the patient's foot. A5513 and 5514s are custom molded inserts and custom fabricated. L5000s are partial foot toe fillers. The difference between an A5513 and an A5514 are simply how the inserts are manufactured. The A5514 is the primary method used by manufacturers utilizing digital CAD/CAM technology. This method can utilize foot scans submitted digitally or by receiving a foam impression or cast and scanning that to load into the CAD/CAM system. The reimbursement for an A5513 and A5514 are the same, and SureFit uses the A5514 method for milling the inserts. If there was a reason for using the A5513, it would be indicated on your invoice. All SureFit inserts meet the Medicare requirements as outlined on this slide. Okay, so Medicare will cover the following each calendar year. There's 1 pair of shoes, 3 pairs of inserts, and if you order an L5000 toe fill, Medicare will reimburse 1 toe fill per foot per calendar year. The L5000 uses a cork base as opposed to a typical EVA plastizote for a standard custom insert. I'll walk you through the documentation requirements, so let's start with some definitions. Certifying physician provides the medical care for and manages the beneficiary's systematic diabetic condition. The certifying physician must be a DO or an MD. The certifying physician may not furnish shoes unless he or she is in a defined rural area or health professional shortage area, and the certifying physician cannot be a podiatrist. The prescribing physician writes the order for the therapeutic shoes, modifications, and inserts. This may be a podiatrist, an MD, a DO, physician's assistant, nurse practitioner, or a clinical nurse specialist. This person must be knowledgeable in diabetic shoes and inserts, and the prescribing physician can be the supplier. The supplier is the actual entity that furnishes the shoe, modification, and or inserts and bills Medicare. So the supplier may be a podiatrist or other qualified individual. The prescribing physician may be the supplier, and the certifying physician may be the supplier only if he or she is practicing in a defined rural area or a defined healthcare professional shortage area. For an item to be covered by Medicare, a written, signed, and dated order must be on file with the following criteria. The patient has diabetes mellitus. Information is documented on the statement of certifying physician. And number two, the patient has to have one or more of the following conditions: previous amputation of the foot or part of either foot, a history of previous foot ulceration, a history of pre-ulcerative calluses of either foot, peripheral neuropathy with evidence of callus formation, foot deformity, or poor circulation. And the certifying physician who is managing the patient's systematic diabetes has certified that the indications 1 and 2 are met, and that he or she is treating the patient under a comprehensive plan of care for his or her diabetes, and that the patient needs diabetic shoes. So here are some important dates that the paperwork must adhere to. The certifying physician, the statement of certifying physician must be signed and dated within 3 months prior to dispensing footwear. The prescription must be signed and dated within 6 months prior to dispensing footwear. The physician treating the diabetes must conduct a clinical foot assessment within 6 months and document the foot conditions. Clinical notes should be reflected on the SCP. We suggest this being the first question you ask when identifying a patient for diabetic shoes. If they haven't seen their MD or DO within 6 months, they will need to have that done prior to starting the shoe order process. Suppliers will have clinical notes on file or have access to those notes. So before we jump into our solutions, I just wanted to quickly review our product offering. Think of SureFit as your one-stop shop. We carry Anodyne, Dr. Comfort, Apex, Brooks, New Balance, Apis, ProPay, and our own SureFit line. The benefit to your practice is that all of the customer support, billing, our manufacturing lab, and the warehouse are located just outside of Atlanta, Georgia. This means that you can give your patients access to all the shoes they know and love while only dealing with one vendor, one invoice, and one American-based customer support team. With this variety of brands, you should be able to find an option for nearly every patient. Now let's talk through the MDM program, Medicare Document Management. Today I'm going to give you a high-level overview of its capabilities. And then following the call, you'll have my contact information, and I'd be more than happy to set up individual demonstrations over Zoom. We can focus on your specific practice and needs at that time. The MDM program was built to reduce the amount of time that your staff spends on collecting documents while ensuring you meet Medicare requirements in the event of an audit. Our team will manage the MD-DO outreach and will review all paperwork for accuracy. In addition, we will review the MD-DO notes for reference to diabetic care. If this is not present, we will reach out directly to their office and document this in the order history. So this is an optional service. If you choose to utilize the service, there is a $5.49 per order fee, and we only bill this if we are successful in obtaining all the documentation and ship you the shoes and inserts. This system will allow you to streamline the paperwork, offload the PCP follow-up, keep track of deadlines and due dates, eliminate orders for patients with incomplete paperwork, and increase your first-time claims. This will also provide you with the ability to centralize your data. So here's an example of the MDM dashboard. This will allow you to see all of your patient orders that are either in progress, which are at the top here, and indicate what documents we have received. You can also see your completed orders list in the bottom section, and you can click on the order number for a deeper dive into the order history. The dashboard provides you with a quick reference on the status of an order without needing to pick up the phone and call for an update. This is the view once you click on a specific order number When we have received all the documentation, we will extract the required dates and populate them on the right side here, along with the Medicare requirements. So for instance, for the certifying physician statement, we will upload the date that the physician signed the paperwork, along with a reminder of the Medicare guideline. This will save your staff time in searching through all of the MD/DO notes to make sure that the paperwork is valid. If any of the dates fall outside of the Medicare requirements, we will notify you through the portal. And we will also provide you with tracking information once the shoes and inserts have been shipped. There are a lot of things that your office may need to ensure an accurate and timely payment for diabetic shoes. Our system has it all documented to minimize the likelihood of missteps or missed documents. If something is missing, our system will flag it and track it down. Our MDM support team will communicate with you via the portal to ensure there is ongoing two-way dialogue. So your practice name will appear on the notes that are being sent through the portal. The system will create your diabetic note based on the particular information that you provide for that patient. This will allow you to electronically sign the documents prior to starting the automated fax process. In addition to our MDM program, another service we provide is our shoe selection guide and fitting support system. The common challenge we hear is that patients may want shoes that are not appropriate for their conditions. It's important that the fitter dictates the shoes that the patients are selecting from. This is a medical device at the end of the day, and it will only be effective if it's for the correct condition. So to facilitate this, we provide you with fitting guides that make it easy for you to show your patient which options are the best fit for them. We've created 3 categories and can provide you with further detailed information by one of our certified podologists. Shoes come in a variety of lasts, which can vary between shoe brands. This can make sizing a little bit more tricky than just using one brand. The upside to this is that the variety of brands will offer additional sizes and widths to accommodate all of your patient needs. And we can help your staff ensure proper ordering by using 2 easy options. First one is we can train your staff on shoe sizing and fitting and provide you with brand devices specific to our catalog. Number 2, we can provide you with the measuring tools to make 4 simple measurements, and our team of 4 clinical certified podorthists will make the shoe sizing selection for you, and that's at no additional cost. Utilizing the service helps reduce returns and provide you with a money-back guarantee on sizing exchanges. This is a way to lean on our experts for proper sizing of the shoe brands that your staff may not be familiar with. Additionally, we do work with the structured scanner and iPads for custom diabetic inserts. Our team can train you on the your existing device or assist you with acquiring a structure scanner. You can place orders online through the scanner, foam impression, or order form, and utilizing our MDM ordering. We will provide you with catalogs, measuring devices, and shipping labels at no cost. We also have shoe display options for those interested. So thank you for your time today. I'm really excited for the potential to partner with your practices. Please let me know if there are any questions. My contact information is listed here.
We do have some questions that did come in, Scott. So I don't know, are you able to read them? Would you prefer that we field them for you, or do you want to take them on? It's up to you.
Let's see here. I can see them here. I'll pull them up. All right.
Less reading we have to do. I mean, I'm all for it, but if it makes it easier for you to process the questions, if we read them to you, just let us know.
All right, this should work just fine.
Okay.
Yeah, we'll go through these and do our best to answer. We do have, the nice thing about SureFit is we have a lot of specialized people that work specifically in different areas, whether it be the Medicare document management piece of it or the fitting and everything. So let's go to the first one. So I have an MD that won't sign the forms and tells my patients to just go buy a good sneaker. Are there any
really nice of them?
Yeah. Are there any studies I can present that prove the DM shoe program prevents ulcers, amputations, etc.?
So I'll take that one, Scott. This is Nick Turner here. Yes, we absolutely have clinical data we can provide over to you. We have your contact, so we will happily email it out after this call. But I do think it is education of your referring providers is critical. A lot of them look at shoes and inserts as a nuisance, but when they see the data around it and they can see the clinical studies, it really makes a significant difference in preventing amputations and more complex pathologies. So it's really to their benefit to support you in providing the best care possible. So we can absolutely get that. And it looks like Dr. Perry had a follow-up question, and I'm going to take this one too, because I was just in one of these classes. So Dr. Perry asks, how can a drugstore employee be a quote unquote qualified individual? So in order to be a qualified individual in the eyes of Medicare, you have to have had some type of training. And there are courses out there. Specifically, there's one for the Certified Therapeutic Shoe Fitter training course. It's provided in conjunction with one of the O&P boards, the ABC board, and the requirements for it are honestly pretty minimal. So I recently myself just attended a certified shoe fitter course training in person. And I will tell you 17 of the 20 attendees there were all from drugstores, mostly in rural areas. Many of them were with like Health Mart chains, but many of them were all going through the certified shoe fitter course. And in the eyes of Medicare, once they've done that course, they then are considered a qualified individual. There is a test if you want to have those credentials and use them manually. And there's, of course, ongoing dues like there is for everything else. But in the eyes of Medicare, which they leave it a little gray with just qualified individual, simply taking that class once qualifies a drugstore employee to be qualified, which is why we've seen an uptick in, especially in more rural areas, in pharmacies doing shoe dispensing.
I just wanted to say something really quickly along those lines, Nick, and I'd be interested in your opinion on this. Obviously, podiatry practices are up against drugstores for patient education with, you know, this type of thing. I mean, if they're certified, I'm sure there are a lot of patients that feel like they're in good hands, you know, and that maybe seeing a physician isn't always necessary. So I guess I don't know if you guys have any thoughts either, but like I would always implore the more podiatrists can do social media and really just be more at the forefront of that type of patient education, because drugstores are always going to have those huge Walgreens dollars benefiting them over private practice dollars. So I don't know. That's just my 2 cents in terms of, in order to sort of combat that, really try to work on the social media presence to get in front of your patients and become the authority on those types of issues.
Absolutely. I would completely agree. And I would also just throw in there that I think a lot of it comes down to both patient education, but also referral source education. I think that's an area that we're really trying to as well develop more materials and more handouts to help educate referring providers. You know, what we saw in the last couple of years, I'd say, and I've been on the practice management side running clinics, and now I've been back on the supplier side, is, you know, during COVID, a lot of practices got out of shoes, and seemingly pharmacies were who picked up a lot of that slack. But overall, you know, therapeutic shoes are still grossly, you know, as a market, shoes and inserts are grossly underserved. There's not enough providers. That's why you see those stats around many of the patients qualified aren't getting them. But I do think this is an area, you know, even on the O&P side where we have hanger clinics, we see that somebody coming in for shoes and inserts and has diabetes, they're coming in for other conditions. So if you take the route of, I'm just going to refer them out and let somebody else deal with this, it might make your life a little easier maybe on the shoe side, but you're potentially losing those patients for other conditions and other follow-up visits or their family and friends. And that's really kind of a lost opportunity there. So, you know, keeping those patients in-house and not risking them whether they go to a pharmacy or to the podiatrist down the road who does shoes, that keeps that patient in your office, and you don't have to acquire more patients. Rather, you're seeing, more from existing clientele. But that's something that I know a lot of practices struggle with, and especially during COVID, with staffing challenges and, having that key person who knew how to do shoes leave. We've seen a big kind of gap in knowledge, which is why using a program like the MDM program we offer, I think really makes a big difference, because it allows you, if staff leave, you're not relying on all the information being in that person's head. Rather, you have a system that you can plug and play and train somebody new on. And if they turn over, you can keep going, as opposed to having the whole program kind of crumble around you.
Yep. Well said. And I think part of that too is just really this saving your office staff some time, in the fact that the system is going to then on the back end do a lot of the follow-up work. So your staff can just check and say, hey, did it come in? And they don't actually have to pick up the phone and make those calls all the time. All right, so we'll go to the next one here. Can an L5000 be dispensed each year? I thought that was not part of the therapeutic bill, but is part of an orthotic LCD and subject to the same or similar denials, and not able to dispense every 5 years. So
go
ahead, Nick.
Sorry, go ahead, Scott.
Oh no, that's if you were going to jump in, go ahead there.
Yeah, so an L5000 in the context of diabetic shoes and inserts can be dispensed each year. It's actually not subject to same and similars, like you deal with a walking boot or a custom AFO. Our clinical team has, data and literature around that. So we'd be more than happy to follow up with you if you'd like, Dr. Maribeth, and we can get you that information, just validating that an L5000 for a partial amputee or an amputee can be done annually in conjunction with shoes and inserts.
Okay, next question was, will you do an MDM for other suppliers? So is that suppliers for a different shoe supplier?
That's how I read it.
Okay. Yep. Yeah. So the program that we've developed, we've started this, over, I would say, probably 15 years ago, and it's been developed. We have Medicare specialists on staff that keep up to date with all the changes. So the program is set up to manage the documentation for our program. It's for the ordering of our shoes and inserts. And we have a various different options for that. So, you can have an option if, the base option, basically you can go on the system, create the paperwork. If you prefer to do the faxing and reviewing the documents yourself, you can do that. And then we also offer kind of the full service, whereas the documentation is being faxed, it's being sent back to us. We review it, make sure that everything is signed and dated. We also make sure that the notes actually reference diabetic care, because a lot of times you'll get 100 pages of notes and there's nothing in there about the diabetic care. So we make sure that's all correct before we release the shoe out to you. So.
Yeah, and I just throw in there, while you can't use the MDM service and then buy shoes from somebody else, we do carry Apex, Anodyne, Dr. Comfort, ProPay. So we have nearly every shoe vendor or shoe manufacturer within our portfolio. And really the reason for that is, again, because we're part of Hanger, we're supporting 900 O&P clinics. Those clinics, the physicians have choice in terms of what product they want. So we've negotiated excellent deals with all of those suppliers.
All right. So what if the certifying physician does not have a foot exam in his progress notes? Is it sufficient that the CP sign the RMR saying that he or she agrees with our findings in our foot exam? So that would be the certifying physician. The certifying physician would need to have notes as part of it. If they do not have the sufficient notes, the patient would need to go and have the notes completed for that particular patient. Just agreeing with the findings is not enough.
So one thing I'll clarify there, and this is a perfect example of where this all gets muddy and gray, is if your RMR is specific enough and outlines stuff potentially from the notes, there definitely is a gray area where you could pass an audit. And that's something that our Medicare and our MDM team will look at each note individually and have the justification in the case, not if, but when an audit might happen, because we all know that's usually the case. But it's critical that your RMR not only kind of be to the letter of the Medicare requirements, but that it tie it all together. I agree with Scott in that it's always safer if they have the specific foot exam notes. There are kind of some ways around that, but that's part of where this gets to be a little more art than science, which unfortunately, as we all know, depending on who your auditor is, that tends to be the battle every time.
Yeah, good point. And to that, we're going to review it by the letter of law of Medicare. And, at any point, this is the system that we've created. But if you would like to have a shoe released, at any point you go in and just say release the shoe if you're feeling like that's sufficient notes or that they had provided, or you feel like you have sufficient documentation. But basically what we're going to do is we're going to say, hey, here's how we're reading this. Here's what our suggestion is, and go from there. All right. So let's see here. Is shipping included? So generally, Nick, how do you want to answer that?
Generally, no. And shipping's an additional fee. I'd say just like every company, we had a much more lenient shipping policy pre-pandemic. And just like every company who got, and yourself, whether you're ordering on Amazon or for your business, FedEx, UPS fees and fuel charges have gone through the roof. So typically shipping is going to be an additional charge with us. That's just unfortunately kind of the reality in terms of the high volume nature of it. We do have programs though that, instead of getting one shoe shipped at a time, we can consolidate shipments to once a week. That cuts down on freight dramatically and allows for you to kind of get all of your shoes at once instead of having a rolling stream the way I have at my house, where it feels like Amazon knocks on the door 3 times a day. We can consolidate that shipping, and we offer other programs to reduce freight costs.
All right, let's see here. Next one is, can we use our iPad or iPhone for scanning? So we have a app that we use called Fusiform Cast, which would be used through an iPad and a structure scanner. And right at this point, that's how our system is able to accept those particular scans. There's some other things that we're looking at as technology advances, but that's the main method of how we're receiving scans for custom inserts right now.
And we are working towards, like many companies, figuring out how can we all get rid of a structure. And I know Structure's come out with Structure Lite, which is supposed to be an app that works directly with the iPad or iPhone that allows you to cut out the hardware of the scanner. I was just talking to one of the largest users of it in the country, and he was saying, Apple did an update and now all iPhone 13s and 14s are measuring 2 centimeters off, which has caused issues for all of their, phone direct scans. The other interesting nuance with the phone and iPads right now are many of them design the scanning, if you're not using a structure that attaches onto the scanner, they designed it for frontward facing, which doesn't sound like a big deal, but if you're trying to take a scan and you're holding the phone facing yourself, trying to wrap around the foot, it actually can get a little funky. So, honest feedback is that's the direction the technology is all going. It still has a lot of room for improvement. It's light years ahead of where it was 5 years ago. 5 years from now, my guess is all the hardware will be gone. and everybody will just be using phones and iPads directly. But, for right now, we feel the most confident in using the structure scanner itself just because of the accuracy. But obviously, the big advantage of using that scanner is you're getting rid of all your foam costs and a lot of additional shipping charges. So it's a big advantage. It's where the industry is going. I know some people are going to tell me they're passionate about the fit from a cast. If you do a cast, we still take that as well, but we're definitely seeing a big push towards people going to scanners and structures.
I mean, so many functional, because you guys do the diabetic inserts. You guys don't do the functional orthotics, correct?
We do in other markets, but it's not a focus for us in podiatry. So, but yeah, that's where everything's going, Sarah.
I mean, almost every lab is using structure sensors. So at least you guys are working with the same tools that all of the labs are that physicians will likely already have in their offices, or not definite, but there's a good chance.
Yeah. And there's a good chance too, that if you decide to go with a structure scanner for your diabetic shoes and inserts, your functional lab will take it as well, or vice versa. So you're going to pay off any cost associated with that investment within a month or two, honestly. And from a time standpoint, it cuts down on freight, but it cuts down on those days in shipment. So you're going to get product back to you faster. And realistically, 98% of companies, when they get your foam or your cast, they're just sitting there scanning it in their office and then tossing it in a pile anyways. They're not actually, using that hard cast for anything other than to scan it themselves. So you're just cutting out a couple steps in the process and a couple of days of production time.
All right, next one is for the portal. Do we just submit the paperwork that we receive back and you go through it to make sure it's all there, or do you call the PCPs and endos to obtain the paperwork? So how our document management is set up would be that we would set up a user inside the portal. And then what you would do is you would go in, place the patient information with the diabetic care, with the diabetic conditions, and the system will generate the documentation based on everything that you put in there. So this is your note. This is all information that you're providing. It just keeps it in a nice place for, to access it in one particular place. And then it will fax it out to the PCPs with a cover letter asking them, basically we need your signatures on the particular forms and to return the PC or the note back so that we can review that as well. So once everything comes back in, then we take a look to make sure the dates are correct. The correct people have signed it, and that it references the diabetic care. And then at that point, we release the shoe. So you're kind of doing the shoe ordering and the paperwork preparation on the front end. And then as the paperwork is out there, if we do get something back that's incorrect or we have additional questions, we would then reach out directly to them and request what's needed at that point. So
yeah, just to put a finer point on that. Yes, we're essentially doing the calling to your referring provider. We do it by fax. If there's an issue, we'll call on your practice's behalf. But that's really where it's taking a lot of the burden off your staff so that they're not out there chasing the paperwork. We're going to do that for you.
Yep. And to a point of that as well, since you're not faxing your actual notes, you're creating the specific notes that reference the diabetic care. You will be able to, we would set you up with an electronic consent form that you would sign one time. So we have that on file for Medicare. Then once the order has been placed, you would just go in, put your login in, your password, and then that would apply the electronic signature before it's going to go out to the MD or DOs.
So jump in. It looks like Dr. Perry, you had two follow-up questions to my comments around drugstores. What if the drugstore doesn't have it? Can I threaten them? Do they have to display the credentials? So if they're not an ABC certified lab, they don't have to display the credentials. Furthermore, depending on who they are credentialed by, potentially if they have a CPET on staff or if they have another provider who's considered qualified, certain licenses can grandfather kind of people under their scope of practice to be certified. That's where it gets gray. Unfortunately, Medicare didn't do us many favors with spelling out what a qualified individual really is. In terms of threatening them, I would defer to your attorney there. So I'll kind of go through that. So the next comment that came out from Mayor Beth, though, I think is a really good one. The rural areas have a bigger issue with the SHU program in that no MD DOs, they only have options of NP. So that's a great point. So there's actually this whole PCF demonstration model that was really built around trying to help rural areas where patients aren't regularly seeing an MD, they're seeing an NP. It's pretty complex, though, in that just because they're in a qualified rural area doesn't mean that they can automatically sign off. They have to actually enroll in that program to be qualified. So we could honestly do an entire webinar just on that topic for rural areas because it's super complex. It could be potentially great for both providers such as yourself and for patients, but there's still an incredible amount of gray area around it. We have one of our medical experts on staff is really an expert in that field. So if you'd like, we'd be more than happy to get a call set up after this to go more in depth on that because that whole model is pretty complex. And it looks like Dr. Perry, you had a follow-up on drugstores. We don't sell into drugstores. You know, I routinely see a lot of our competitors. That seems to be one of their biggest market just because drugstores have picked up a lot of the slack in the last couple of years, but our call point is podiatry. So SureFit's very podiatric focused in terms of external. And then internally, we help along with our parent company service our hanger O&P clinics. Scott, do you want to take the RMR?
Yeah, it's the relevant RMR stands for relevant medical record. So it's what the system creates is the certifying physician statement, which is going to list out the patient information as far as what qualifies them for the diabetic condition, and then that's where the MD or DO would sign off, and then the relevant medical record would be your podiatry note, and then where the signature of the MD or DO would sign that they're in agreement.
So it looks like the next question is, what is a safe mix of standard versus custom inserts, 50-50, 75-25? I think we just did a webinar last month where Cindy Pezza spoke about this. Scott, tell me if I'm wrong, but I think her feedback was it's got to be based off the patient's needs and it shouldn't be 100 either way. Not every patient needs a custom based off how complex or how basic kind of their foot conditions are. But likewise, not every patient needs a heat moldable. Some do need custom. We tend, my personal experience is in the podiatry field, I tend to see more non-custom dispensed, especially compared to the O&P space where it's probably 80% custom, 20% heat moldable. In podiatry, I'd say it's probably the inverse of that, where it's closer to 60% heat moldable, 40% custom. But I think it really comes down to your professional clinical opinion. Scott, any feedback from your end?
I think you're exactly right. It could vary, and it's really your professional opinion on it. And I think if you have the documentation as to why you're doing a custom over a prefab, ultimately there's no safe place where it's 50-50, 75-25. But I would agree with you, Nick.
If you're looking at it from a financial standpoint, I've heard doctors say, well, the custom reimburses more. It's true, but the custom also costs more for you to get and for us to make. So while the reimbursement's higher on a custom, a heat moldable is doesn't reimburse as high, but the cost is a lot lower. So, don't just be swayed by looking at top line dollars. I definitely look at, the bottom line, but first and foremost, I'd say it's really about what the patient needs. So Dr. Perry followed up with, how many times is it safe to fax a PCP without pissing them off? It's a good question, and it's one we certainly have dealt with, especially if a practice isn't used to getting it. One thing I'd say we advise our doctors, especially if they have relationships with their referring providers, to do is, if they're coming on board with us, to reach out to their referral sources to tell them they're going to be using a new program to help deal with the paperwork. Usually when referral providers hear that, they understand, and they get that paperwork's a huge headache. So they understand that it's going to be different than how they used to get it. But having said that, Scott, do you want to talk through how many times we'll send a fax before we put our hands up and reach out to?
We've adjusted it over time. I think where we've kind of landed, where we're able to get them in a timely manner, but not be overwhelming for an office, is we'll fax it once per week, up to 5 weeks. If there's no response in that time frame, we will reach out to you directly and let you know, hey, we haven't gotten anything. We'll try 2 more times. And then if we don't get anything again, then we'll cancel the order out.
Scott, do you want to go through the cost on the MDM portal?
Sure. Yeah, the MDM portal, again, so you have the ability to go on and to place an order through the system. If you choose to print the paperwork out yourself, fax it yourself, and review it yourself, there's no cost for that. What we call a CMN RMR is where it will create the documentation. It will fax it out. We will get it, and then we will let you know that the documentation's been received, and then you will review it for accuracy. The one that most of our customers are using would be what we call an MD ad. So that's going to be the faxing, the getting the documentation back, and then a full review on that before we release the shoe out. And that's $549 for the full service, $349 for the CMN RMR, and then if you're just printing the paperwork yourself, it's no cost.
And just to be clear, $3.49, not $349 or $5.49, $5. So if you think about this, the time your staff is spending on this, it's a no-brainer to your bottom line. Another question came up: how common are shoe audits? What is your experience with the outcomes? They're about as common as audits for anything else. If you haven't been doing shoes in a while and you start doing shoes and start ramping up, you're likely going to get an audit, because like anything, they're using an algorithm to figure out what's out of the ordinary for you. And once something's out of the ordinary, they're going to send out a pre-targeted, audit or a request or a records request. We find our practices tend to have, that are using our full program, have excellent outcomes. Our staff will work with your teams to help support you when you get those. What I would say, it's varied in terms of audits. There was a time 7-8 years ago where, especially in the Southeast, audits were really picking up. And I remember hearing from clients down in North Carolina and in the Carolinas that they were driving them nuts, whereas we had clients in other parts of the country that hadn't seen an audit in 5 years. It tends to come in waves. It tends to be specific to who your Medicare MAC coverage provider is. And also, as you all know, they all hire third-party firms then to do a lot of these audits. We often will find that the people doing the audits don't really know what they're doing either when it comes to shoes and inserts. So by using our system and having everything so organized and being able to export it and send it, it tends to really put leave a good impression with the auditor that you have your act together and know what you're doing, and it's not going to be worth their time because they get a percentage of what they ding you for. And if you look like you have your act together and are organized with a request, it's may not be worth their time and headache. Whereas, if they put out a request, it takes you weeks just to send over some kind of mismatched patient records, then they know they're onto something and will start digging deeper. Next two questions. Does anyone fax anymore? Yes, courtesy of HIPAA, fax is still pretty prevalent. I joke about it in other industries because everybody thinks it's a dinosaur. Most people use eFax. We use eFax. But, thank you to HIPAA for making fax still relevant in the medical world. Can't make it up. Any difference between straight Medicare and Advantage plans? Yes. Every Advantage plan can vary pretty wildly. There's a lot of complexities there. Straight Medicare is mainly what we were talking about with the MDM program. A lot of Advantage plans follow it, but regionally, a lot of them don't. We've seen the trend of more and more Advantage plans and Advantage plan customers coming on. And what I would say is, you need to look at each particular carrier to probably determine what the requirements are, but also, is it worth it for you to do those?
I can see your lips muting.
I know. I always double mute myself, and sometimes I forget to do one. But I was just going to say, it looks like those are all the questions that have come in so far. We've got another couple of minutes before we hit that 9 o'clock mark. So if there is anything else that's weighing on your minds, you've got another couple of minutes to get those in. It's not like we're going to gong you or anything, but I know an hour is quite a bit of time for everybody, and it's getting late on the East Coast, but at least the sun is still up a little bit. But I am so excited about this session, and I think what's so great about the opportunity to have you guys on with the DPMs that joined us this evening is it's not like we're unaware of the purpose of diabetic shoes and inserts. Obviously, there's a clear need and there's no confusion on what that need is, but it's when you get into the nitty-gritty of all the paperwork and I mean just the red tape that makes protocols and being able to see some of the most at-risk patients that exist so difficult, and that's really unfortunate. And so I think it's really great that you guys are able to take the time to get those questions answered, because I think it is really important to do more Q&A versus just unidirectional lecture, because again, I don't think there's a lot of confusion on what the need is. It's how you can actually get it done.
Yeah, you guys have really impressed me with all of your questions this evening, and I'm so glad that we were able to get them all answered. We did have another question come in, so Scott or Nick, if you want to take a look at that. I am going to put both of their emails, Scott's and Nick's, into the chat. So if you want to reach out to them directly, you're welcome to. So I'm going to type that in now.
I'm saying that, yes, with shoes and inserts, the Medicare Advantage plans can be more challenging to work with than straight Medicare, because even though they are a Medicare subsidiary, they don't all follow Medicare guidelines, and they can vary wildly regionally. And it just adds another layer of complexity based off both what requirements they have, but also what they might reimburse. So Medicare Advantage plans don't necessarily reimburse what Medicare reimburses. We've seen some Advantage plans that are just like private insurances don't either. I think a common one I hear complaints about would be United Healthcare. Reimburses pennies on the dollar, it feels like, compared to straight Medicare. So there's definitely a lot of nuance there. Happy to discuss individually or offline, but it's definitely not as straightforward, like many things, unfortunately, in coding and billing and podiatry, as any of us would hope.
Yeah, whenever we have webinars like this or our Practice Partner Academy sessions and we get to discuss billing and coding, it is always on fire because it's such a important topic and it's something that is kind of left open to interpretation. So we're just glad that we have experts like Scott and Nick to help us, weed through it all.
I'm just glad I don't have to do it. Which honestly, and that's one of the great things about the services that you provide. That you are able to allow people to kind of wash their hands clean of some of these items that take them away from the importance of the actual patient care and less of the paperwork. So I think that's a great service that you guys provide. And I don't know, when we started this session, we did mention that this is the first SureFit session that we've had. And so with that, we also have a new SureFit virtual booth. That's a lot to say. So that's a little tongue twister. So if you haven't taken the time to go to our marketplace recently, go to podiatrymeetings.com, check out the marketplace, and there's a bright new shiny SureFit booth there for you to just kind of roam around, check out. And some of, obviously, these programs are available for you to research there. You can obviously also just go to the SureFit website, but I like for them to see the fun booth that we've created.
Yes. So what is next for SureFit for you guys? Where are you going to be? What do you have coming up that's exciting? What's going on?
So we have just gotten through, I think, 9 trade shows already. So we have a couple weeks off the road, I believe. We will absolutely be at the National in Nashville. I know we have the Texas show in the fall, Top Practices, the American Academy of Foot and Ankle Pediatrics. So we've got a pretty busy schedule. We will likely mix in 1 or 2 more shows here in June, but we, at the very least, we would love to see you all or meet you in person down in Nashville if you're going to the APMA in July.
And we will be there as well. So we'll all have to do a big powwow. So that'll be exciting. But yeah, like I said earlier, with everybody who's online, if you've been at shows, if you've been to conferences in the last several years, I'm sure you've seen Scott and Nick's faces bopping around the exhibit hall and such. So I'm excited to see you guys. And I think, are we ready to sign off? Did you guys have anything else that you wanted to wrap with?
Anything else, Scott or Nick?
No, just appreciate everybody be staying engaged. I know this is not the most entertaining Monday night conversation necessarily, but we love it. We're passionate about it. Back to the comment at the beginning, we want to be your partner. We want to help you be successful. We want to help you stay in private practice and provide the best care to your patients possible. So we're excited to work with you. Josh is no longer with us or with SafeStep, which we often are confused with. We do distribute SafeSteps products such as Apex, though. And then the other question, yes, we will be at the National, and we would be happy to share with you any of the clinical data. So thank you. From my side, Scott, anything you'd like to close with?
I think that's pretty much it. Appreciate everybody's time. There was a lot of great questions that we went through. So hopefully we answered the majority of it, and the ones that we didn't, we'll follow up with.
And most importantly, thank you, Ann and Sarah.
Yep.
You're
for
welcome.
doing
No,
this on
thank
your
you.
Monday night.
We're happy to help. And we'll be
usually
sending,
do these sorry, go ahead.
I was just going to say, we'll be sending you 2 reports for everything so you can follow up with anybody that had questions or wanted to get additional information.
Yep. And we usually do these on Tuesdays. So I had to reprogram my brain to do it on a Monday night. So it was nice to keep me on my toes, mind the podiatry pun.
Yes, thank you for being flexible.
Yes, that is awesome. And with that, everybody online, keep your eyes peeled for updates with our next upcoming Practice Partner Academy. We love to see you guys here all the time. So don't let us be lonely. And I guess that's all I want to say.
Yeah. All right. Good night, everyone.
Bye, guys.
Hey, thank you.
Bye.